Nausea and vomiting. Vomiting is an uncontrollable reflex that expels the contents of the stomach through the mouth. It's also called being sick or throwing up. Nausea is a term that describes the feeling that you might vomit, but aren't actually vomiting. Both nausea and vomiting are very common symptoms and can be caused by a wide range of factors. They occur in both children and adults, although they're probably most common in pregnant women and people undergoing cancer treatments. What causes nausea and vomiting? Nausea and vomiting may occur together or separately. They can be caused by a number of physical and psychological conditions. Nausea. The most common causes of nausea are intense pain, usually from an injury or illness, and the first trimester of pregnancy. There are also a number of other relatively common causes, including motion sickness, emotional stress, indigestion, food poisoning, viruses, exposure to chemical toxins. If you have gallstones, you're also likely to feel nauseated. You may find that certain smells bring on the feeling of nausea. This is a very common symptom during the first trimester of pregnancy, although it can also occur in people who aren't pregnant. Pregnancy-induced nausea usually goes away by the second or third trimester. Vomiting in children. The most common causes of vomiting in children are viral infections and food poisoning. However, vomiting can also be caused by severe motion sickness, coughing, high fevers, overeating. Vomiting in adults. Most adults rarely vomit. When it does occur, a bacterial or viral infection or a type of food poisoning usually causes vomiting. In some cases, vomiting can also be the result of other illnesses, especially if they lead to a headache or high fever. Chronic stomach conditions. Chronic, or long-term, stomach conditions can often cause nausea and vomiting. These conditions can come along with other symptoms, such as diarrhea, constipation, and stomach pain. These chronic conditions include food intolerances, such as celiac disease and dairy, protein and lactose intolerance. Irritable bowel syndrome, IBS, is a common stomach condition that causes bloating, nausea, vomiting, heartburn, fatigue, and cramping. It occurs when parts of the gut become overactive. Doctors usually diagnose IBS by identifying symptoms and ruling out other stomach and bowel conditions. Lifestyle choices. Certain lifestyle choices can increase your chance of experiencing nausea and vomiting. Consuming a large amount of alcohol can cause damage to the lining of the gut. Alcohol can also react with stomach acid. Both of these will cause nausea and vomiting. In some cases, excessive alcohol consumption can also cause bleeding in the digestive tract. Eating disorders. An eating disorder is when a person adjusts their eating habits and behaviors based on an unhealthy body image. It can cause nausea and vomiting. Bulimia is an eating disorder in which a person induces vomiting deliberately to purge the stomach of any consumed food. People with anorexia may also feel nausea due to starvation and excess stomach acid. Serious conditions. Though rare, vomiting can sometimes occur as a symptom of a more serious condition, including meningitis, appendicitis, concussion, a brain tumor, migraines.